Hello and welcome to related to female health, that is UTI, urinary tract infection. So are you looking for homeopathic treatment for urinary tract infection? So in this video basically we will talk about how we can manage urinary tract infection with the help of homeopathic medications. So let's talk about it. So first of all, we'll talk about what exactly is the meaning of urinary tract infection. So let's talk about it. So a urinary tract infection is an infection in any part of the urinary system. And the urinary system include the kidneys, the ureters, bladder and urethra. And most infections involve the lower urinary tract, that is the bladder and the urethra. And women are at a greater risk of developing UTI than the men. And if an infection is limited to the bladder, it can be painful and annoying. But serious health problems can result if UTI spreads to the kidney. Now next we'll talk about what are the clinical features of UTI, that is urinary tract infection. So UTIs don't always cause symptoms, but when they do, they may include a strong urge to urinate that does not go away. Secondly, a burning feeling when urinating. Thirdly, urinating often in passing small amount of urine. Next, urine that looks cloudy and urine that appears red, bright pink or coca colored, which is a sign of blood in urine. Next, a very strong smelling urine. And next is pelvic pain in women, especially in the center of the pelvis and around the area of the pubic bone. Now next we'll talk about the types of the urinary tract infections. So each type of urinary tract infection may result in more specific symptoms, and the symptoms depend on which part of the urinary tract is affected. So here I will be discussing the particular part of the urinary tract affected and what are the symptoms that will be produced that you can feel if this particular part is infected. So first part of the urinary tract which is affected is kidney. So if this infection reaches your kidney, then what are the signs and symptoms that you can feel? First, back or side pain, high fever, shaking and chills, nausea and vomiting. Secondly, if it reaches your bladder, then you can feel pelvic pressure, lower belly discomfort, frequent painful urination and blood in urine. And if it is in urethra, then you will be facing burning with urination and discharges. Okay, so these are the types of UTIs. And next, very important, what are the causes? Now, what is the basic etiology that leads to this condition, so-called UTI, that is urinary tract infection? So, UTI is typically occur when bacteria enters the urinary tract through the urethra and begins to spread in the bladder. The urinary system is designed to keep out bacteria, but the defenses sometimes fail. When this happens, bacteria may take hold and grow into a full-blown infection in the urinary tract. The most common UTI occurs mainly in the women's and affect the bladder and the urethra of the bladder. This type of UTI is usually caused by E. coli, that is Escherichia coli. And E. coli is a type of bacteria which is commonly found in the gastrointestinal tract. But sometimes other bacteria are also the causes. Next, infection in the urethra. This type of UTI can happen when gastrointestinal bacteria spread from the anus to the urethra. An infection of the urethra can also be caused by sexually transmitted infections. They include herpes, gonorrhea, chlamydia, mycoplasma. This can happen because women's urethra are close to the vagina. Now, what are the risk factors? So UTIs are common in women's, and the risk factors of the UTI. So babies which are born with the problems with the urinary tract may have trouble urinating. Urine can back up in the urethra and which can cause UTI. Second, blockages in the urinary tract. Kidney stones or enlarged prostate can trap urine in the bladder. As a result, a high risk of UTI is higher. Next, a suppressed immune system. Diabetes and other diseases can impair the immune system and the body's defense against germs. This can increase the risk of UTI. Next, catheter use. People who cannot urinate on their own often must use a tube called a catheter to urinate. Using a catheter increases the risk of UTIs. Catheter may be used by people who are in the hospitals, and they may also be used by the people who have neurological problems that make it difficult to control urination or who are paralyzed. Next, a recent urinary procedure. Urinary surgeries or an exam of your urinary tract that involve medical instrument can both increase the risk of developing UTIs. Next, menopause. After menopause, a decline in the circulating estrogen causes changes in the urinary tract and the chances of increase the risk of UTIs. Next, sexual activity. Being sexually active tends to lead to more UTIs, and having a new sexual partner can also increase risk. And next risk factor is certain type of birth controls. Using diaphragms for birth control may increase the risk of UTIs. And using spermicidal agents also can increase the risk. So these are the basic risk factors for UTIs. Now next we'll talk about the treatment. So what is the ultimate treatment for urinary tract infection? So basically here we are talking about the homeopathic medication, homeopathic treatment for the urinary tract infection. So as we all know that homeopathy is one of the most popular holistic system of the medicine, and the selection of the remedies based upon the theory of individualization and symptom similarity by using holistic approach. And this is the only way through which a state of complete health can be regained, by removing all the signs and symptoms from which the patient is suffering. The aim of the homeopathy is not only to treat the urinary tract infection, but to address its underlying cause and individual susceptibility. As far as the therapeutic medication is concerned, several well-proved medications are available for urinary tract infection treatment, which can be selected on the basis of cause, sensation, and modalities of the complaint. For individualized remedy selection and the treatment, the patient should consult a qualified homeopathic doctor in person. Now let's talk about the top 6 homeopathic medicines which has been successfully used for the treatment of urinary tract infection, that is UTI. So first and the foremost medicine that you can see here on the screen is Cantharis. So Cantharis is basically used for extreme burning before and during and after urination. Okay, the key symptom to look out for while prescribing Cantharis is intense burning before, during, and after urination. There is a constant desire to urinate. Scanty urine or the urine passed in drops from UTI is also best treated with Cantharis. At times, blood in the urine can also be seen. Now, when and how to use Cantharis? So as I have already discussed, the most striking feature to use this medicine is burning sensation before, during, and after urination. So along with the frequent desire to pass urine, Cantharis is best suited in 30 potency. It can be repeated 2 times in a day. Now second medicine. Second medicine for the UTI is Apis Mellifica, for the severe burning while passing urine. The person requiring Apis will complain of a burning or a stinging pain while passing urine, especially last drop of the urine cause intense burning. There is also bladder tenesmus, that is sensation of incomplete bladder emptying even when there is no urine left behind in the bladder. In some cases, blood appears in the urine. Now, when and how to use Apis? So it can be used when there is a burning, stinging sensation during urination, and mainly when passing last drop of urine. It can be taken in low 30 potency that can only be repeated twice in a day. And it can also be used in 200, but in order to do so, one should carefully look for the symptoms and not repeat it frequently. Now let's talk about the third homeopathic medicine for UTI, that is Sarsaparilla officinalis, or the intense burning toward the end of the urination. To treat UTI with the intense burning when the person finishes urination, Sarsaparilla is the most reliable medicine. Other accompanied characteristics for use of Sarsaparilla are scanty urine, urine with pus and blood, pain in the urethra extending to the abdomen. Now, when and how to use Sarsaparilla? The key guiding symptom for the use of Sarsaparilla is unbearable pain when urination finishes. It is recommended mainly in the 30s potency and give expected results. Dose can be repeated depending on the severity of the symptoms, but not more than 3 times in a day. Now the fourth medicine for the UTI is nitric acid. So for the burning during urination with a foul-smelling urine. Nitric acid is one of the most effective homeopathic urinary tract infection medicine where burning while passing urine is present, which is highly offensive, foul-smelling, like horse urine. Urine is scanty, cloudy, dark, or bloody. You can take this medicine in 30 potency, and normally use of this medicine is limited to once or twice in a day, and higher potencies are not recommended until a physician asks you to do so. Okay. Now let's talk about the fifth homeopathic medication for the UTI, that is Sepia. For UTIs in the women, Sepia is rated among the most beneficial medicine for treating UTIs in women, and it is prescribed when there is cutting pain in the bladder, urinary stream is weak, urine smells bad, there is a feeling of pubic area getting pushed down. Sepia is also very useful in cases of chronic cystitis, that is bladder inflammation. It is also recognized as the best medicine for the urinary tract infection in women going through menopause. Now, when and how to use this? So you can use this medicine in 30 potency, but should not be repeated frequently. Now, our last medicine for the UTI is Colibacillinum. So for E. coli positive UTIs, this is one of the best, or you can say wonderful medicine. So Colibacillinum is the best medicine. The symptom to use it include an urge to pass urine frequently, scanty urination, and pain while passing urine. The urine may smell, and blood in the urine is noted in certain cases. Now, when and how to use this? This medicine is always advisable to use in the lower potency, that is 30 potency, and once a day. If there is no improvement, then it is strongly recommended to consult a homeopathic physician. And a very important note. And always remember, you have to consult a doctor, or you can consult me before taking any medications, which I have explained in this video. So these are the top 6 homeopathic medications which I have discussed with you for the treatment of urinary tract infection problem. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy. And thanks for watching this video.